Knowing the causes of death. As we discussed earlier, reliable cause of death data in high-income countries have led to enormous improvements in health and to numerous discoveries. However, cause of death data are exceptionally limited in low and middle-income countries because of historical neglect and insufficient resources. Now, worldwide, there are about 56 million deaths a year that occur currently. And of these, 48 million occur in low and middle-income countries. In most low and middle-income countries, death registration and medical attention at the time of death is far less common than in high-income countries. So therefore, causes of death remain largely unknown. For example, only 3% of the world's children who died, mostly in low and middle-income countries, had a death certificate of the cause of death issued in 2010. Now, one of the key ways to understand causes of death is to get good information in a true snapshot of the population. This is what is commonly called a random or representative sample. However, most low and middle income countries lack these simple systems to get information from a random sample. China, India, and some Latin American countries have either nationally representative sample systems or complete systems. Outside of these countries, however, only 5 countries have random samples of causes of death. And this puts a severe restriction on the ability to know what are the major causes of death and to have programs that address these. Then how do we measure mortality? There are 2 components to consider. The first is to capture the event of death through capturing the age and sex, and ideally the geographic location and education or some measure of social status. The second component looks at the underlying cause of death, which is the disease or injury process that contributes most directly to the death and is responsible for all of the other causes or conditions that arise. Think of someone that had a stroke some years ago, and that stroke eventually led to further problems, including being bedridden, and they developed an infection and died. Well, the underlying cause of death in that case is the stroke. Now, the most common tools physicians use to classify causes of death is the International Classification of Diseases, or ICD, which has been created by the World Health Organization. ICD is now in its 10th iteration, and this is a diagnostic guideline for the most common diseases and the description of those into distinct categories of medical conditions. So, for example, it classifies all strokes and heart attacks into one group and classifies various types of tuberculosis or various types of malaria into other groups. Typically, the ICD-10 code is derived by physicians looking at specific disease signs and symptoms, abnormal findings, complaints, and other information from the record of death or from an interview of the deceased living respondents, which is called a verbal autopsy, which we'll come back to.